Stages of menstruation. In this video, we are going to look at Introduction to puberty, Introduction to menstrual cycle, different stages of the menstrual cycle, hormones involved in menstrual cycle, symptoms of menstruation, puberty. The period during which a child's body matures into an adult is called puberty. Puberty is the stage of human development during which a child's body undergoes significant physical and hormonal changes. In males, the testes, which are reproductive glands, produce testosterone, which is the primary male sex hormone. In females, the ovaries produce estrogen, which is the primary female sex hormone. Puberty is a gradual process that typically begins around the age of 10 to 14, although the exact timing can vary among individuals. Menstrual cycle. In the female body, from the age of reaching puberty, the menstrual cycle occurs every month. The body prepares for the possibility of pregnancy each month, so the lining of the uterus, endometrium, thickens in preparation for a fertilized egg to implant. If conception doesn't occur, the lining is shed through menstruation, marking the start of a new cycle. Stages of menstrual cycle. There are 4 stages in a menstrual cycle. Stage 1, menstruation. The first stage of menstruation happens from day 1 to day 4 of the menstrual cycle. During this period, the uterus lining breaks down and passes out of the vagina. In general, 3 days of bleeding is considered normal. However, it can last up to 7 or 8 days, depending on a range of factors. Stage 2, follicular phase. During the second half of the menstrual cycle, progesterone level increases and the lining of the uterus starts to build again to prepare for implantation. Stage 3, ovulation. Ovulation occurs during the mid of the menstrual cycle, and the egg is released during this stage. The level of estrogen increases just before ovulation to thicken the uterus to store the fertilized egg. Pregnancy is possible only during this stage of the menstrual cycle. For a typical 28-day menstrual cycle, the egg is released on the 14th day. Stage 4, luteal phase. If a fertilized egg doesn't implant in the uterus during the last phase of menstruation, then the uterus lining will break down to start the menstrual cycle. Though the length of the menstrual cycle varies from woman to woman, periods will occur typically every 28 days. Hormones and menstruation. The 4 hormones that play an important role during the menstrual cycle. Progesterone. It helps to prepare the uterus lining for the implantation of the fertilized egg. Estrogen. This hormone helps with the growth of the follicle. It is produced in the ovaries. LH hormone. The LH hormone is produced by the pituitary gland, and it stimulates ovulation in women. FSH hormone. The follicle-stimulating hormone, FSH, plays a critical role in the functioning of ovaries and the development of eggs. Symptoms of menstrual cycle. Most women experience few symptoms before the beginning of their menstrual cycle. Some common symptoms include tender breasts, abdominal cramps, mood swings, headache, tiredness, bloating, lower back pain.